Hello everyone. I, Dr. Kesha Jani from IAP Digital Media team will be hosting today's webinar on women's health in postmenopausal period. The resource person for this webinar is Dr. Debapriya Mukherjee. It is being organized by IAPWC team West Bengal. We are streaming live on IAP India YouTube channel. I request all the participants to subscribe to this channel to receive regular notifications during our webinars. You can also follow IAP social media pages on Twitter, Facebook, Instagram, LinkedIn for updates. Now, I would like to hand over this webinar to our very own moderator, Dr. Kuntalika Chakrabarti. Kuntalika ma'am, over to you.
Thank you, Dr. Kesha. Good evening to all. Today's webinar has been organized by IAPWC East Zone, West Bengal branch. On behalf of IAPWC and West Bengal branch, I, Dr. Kuntalika Chakrabarti, coordinator of North 24 Pargana district and moderator of today's event, I inviting you all to celebrate our Physiotherapy Foundation Day and make the event a grand success. I welcome our President, Dr. Sanjeev Jha sir, our organizing chairperson and national head, Dr. Ruchi Varsne ma'am, organizing co-chairperson and zonal head, Dr. Reena Srivastava ma'am, organizing secretary and state head, Dr. Tanushree Bhattacharya ma'am, organizing co-secretary, Dr. Sonali Sengupta, Dr. Shamshad Begum and Dr. Neha Singh Rajput as secretaries, joint secretaries, North 24 Gana sub-coordinator, Dr. Shatabdi Roy, and all the participants. Today's our topic is women health in a post-menopausal period. We know that the menopause is a time that marks the end of menstrual cycle and it's a natural decline in reproductive hormones. When a woman reaches her 40s and 50s, women may experience a lot of physical and mental illness. So when we look for the management, we take every aspect of health in consideration, maybe by medicine, diet, and exercise. We will get to know elaborately about today's topic from our beloved and eminent guest speaker, Dr. Debapriya Mukherjee ma'am. She happened to be Calcutta University topper and lecturer of Peerless College of Physiotherapy, RK Mission Seva Pratishthan, IAPG, MENR, SSKM Hospital. She was physiotherapist of CAB, Bengal Women's Cricket Team, Metro Railway Hospital, chief physiotherapist and lecturer of Dorodia Hospital of Pain Management, and as well as Hospital of Government of West Bengal. She is also a research associate in ESI Institute of Pain Management. Ma'am, we are very much grateful that we got the opportunity to have you in this webinar and would further request you to share us the valuable inputs in this regards. Thank you, ma'am.
Thank you so much, Kuntulika, and thank you so much, Women's Health West Bengal branch, for giving me this opportunity. It is really an honor. Like in this pandemic era, you are organizing such beautiful events and letting me involved in this great initiative. Thank you so much for that. So shall I start with my presentation now?
Sure.
Okay, thank you so much. So today's presentation is on women's health in postmenopausal period. So what is menopause? Natural menopause occurs when there is a complete or near complete ovarian follicular depletion and loss of ovarian follicular activities, resulting in permanent cessation of her menstrual cycle. So in this picture, we can see that the follicular depletion over aging. As we are going towards the menopausal age, so our ovarian follicular activities are going to be more and more depleted. Now we can see that the menstrual cycle graph. So from the menarche to the premenopause, the graph is going up, and from the premenopause to menopause, it is slowly going down. And you can see the age over here at around say 41 or 42 years, the menopause age is starting till 51 or 52 years. And after menopause, the declination of the graph is very prominent. And along with that, we can see the estrogen hormonal level As we are growing with our age, the menopause is starting at mid-40s and estrogen level is drastically going down after that. And this is according to the estrogen level and the age. We can see this one, that pre-menopause, just before the age of 40 years, normal productive life. But perimenopause, we are having these problems like irritability, cramps, insomnia, vaginal dryness, etc. And in the perimenopause, that is from mid-40s to 50s, we can have irregular periods, night sweats, weight gain, hot flashes, loss of libido, etc. And last period at around 50 or 51 years. And after that, the menopause era, we can have other problems like breast cancer, depression, vaginal discomfort, osteoporosis, urinary infection, heart diseases, etc. Slowly, as we are going through our presentation, we will discuss all these symptoms and signs in a vast way. So what is the age of menopause? The median age of menopause is 51.4 years, but it is starting at around 42 or mid 40s, and generally it cesses at around 51 years. Months and years leading to this are known as the perimenopause. The types of menopause, it can be physiological or pathological. What is physiological? That is spontaneous progressive decline in menstrual cycle due to the decline of ovarian function. And the average age is 40 to 51 years. And this is not a disease, it is just a phenomenon or a part of the life that we have to go through. And the pathological menopause can be of, again, three types. The premature menopause, that is before the age of 40 years. It can be artificial or surgical menopause due to surgical intervention or chemotherapy. And it can also be delayed menopause, that is after the age of 51 years. This transition into and through the menopause can have various effects on a woman's life. There are a lot of symptoms which are subjective. Those are hot flashes, occurs in up to 85% of women, vaginal dryness or sexual dysfunction, depression that can lead to psychological events related to family, changes in the body shape, size and weight, which is unacceptable by the person, and it is very difficult for them to cope with this phenomenon. There can be sleep disturbances, there can be cognitive changes due to estrogen deficiency, difficulty in concentration and memory loss. So what is hot flashes? There are certain information regarding the hot flashes. Intense feeling of heat in the face, rapid or irregular heartbeat, flushing or reddened face and neck, sleep disturbances, perspiration, and cold chills. There are certain events of depression from menopause that keep your doctor in the loop. These are the suggestions. Regular exercises, socialize with friends and families, meditate, eat healthy, reduce alcohol intake, and avoid smoking. There are certain other subjective phenomena which are occurring, which are related to physiotherapy. Those are joint pain, arthritis, musculoskeletal pain, or arthralgia. Joint pain appears to increase during perimenopause or menopause, maybe due to estrogen deficiency. Analgesic drugs such as oral NSAIDs or intraarticular injections can be used as treatment. Although it is still under review, HRT or hormonal replacement therapy has not been shown to decrease joint pain. Weight control and regular exercises are recommended as the best treatment for musculoskeletal pain during menopause. So we will go through this in a little detail. Joint pain is not directly correlated with the changes that take place during menopause, although a shortage of estrogen can impact the bones. There are certain most common menopausal signs and symptoms here. Those are, you can see that the 13 most common menopausal signs and symptoms. Those are memory and cognitive functional deficiency, hair loss, hot flashes, bone loss, skin issues, vaginal dryness, insomnia, mood changes, decrease in breast fullness, irregular periods, urinary incontinence, loss of libido, and weight gain. That can lead to low level of estrogen, decreased estrogen production by the ovaries, low level of testosterone, erratic levels of estrogen and progesterone, and thinner vaginal walls. That can, again, I'm saying the same list, that is mood swing, hot flushes, night sweats, decreased libido, irregular periods, and vaginal dryness. These are the main complaints women are telling you during this period of time. You can see these are the problems women are facing, and these are disastrous problems. So menopause by the numbers. Let us remember these numbers. That is 51 average age period, end for good. That is 51 is the age. More than 5% with early menopause unrelated to a health condition. Around 50 million women in the US currently in menopause. 12 months that must pass without a menopause, without a period, and 8 possible years of perimenopause can last before the menopause. There are certain long-term effects. Those are bone loss, the loss of cortical bone affected by estrogen deficiency and age-related trabecular bone loss, cardiovascular diseases. The American College of Cardiology, that is ACC, and American Heart Association guidelines recognizes the perimenopausal state as a risk factor for cardiovascular diseases, maybe due to a change in the lipid profile, an increase in the low density lipid in women going through menopause. Other effects of menopause are body composition. Women often gain fat mass, spontaneous decrease in activities, decrease in energy expenditure, and decrease in metabolic rate. Balance impairments. Estrogen deficiency has been linked with impaired balance in postmenopausal women. Many of the symptoms and health concerns described here can have negative impact on women's health and overall quality of life. Individualized assessments and appropriate management strategies needed to approach them. First is osteoporosis. You can see in this picture that over the age, how this bone mineral density is declining. There are 9 common causes of osteoporosis in postmenopausal women. Those are estrogen deficiency, mineral deficiency, hyperthyroidism, genetics, smoking, excessive alcohol, inactivity, and medication. It is the condition in which the bone becomes weak and brittle. The body constantly absorbs and replaces bone tissue. With osteoporosis, new bone creation doesn't keep up with the old bone removal. Musculoskeletal symptoms characterized by backache, fractures on minimal trauma, decreased height, and mobility are common due to osteoporosis. It is important to review a woman's risk factors for osteoporosis when making treatment decisions and to consider bone mineral density for high-risk women. Osteoporosis causes bone to become brittle, so brittle that a fall or even a mild stress, such as bending over or coughing, can cause a fracture. Osteoporotic fracture most commonly occur in hip, wrist, and spine. More than 10 million cases in India per year are having these problems. You can see that osteoporotic bones and how these trabecular systems are changing with the age. You can see the same thing, and level of estrogen is playing a very crucial role here. You can see that by this graph, the estrogen deficiency over the age and how the bone mineral density is changing with the age. There are certain signs and symptoms of osteoporosis. Those are back pain caused by a fracture or collapsed vertebra, loss of height over time, a stooped posture, a bone that breaks much more easily than expected. There are certain risk factors, which are non-modifiable risk factors. Those are age, Asian race, family history, small body frame, and hormonal level. We can see already that the reduction of estrogen level in women at menopause is one of the strongest risk factors for developing osteoporosis. There are certain modifiable risk factors also. Decreased intake of calcium and vitamin D, smoking, sedentary lifestyle, that is people who spend a lot of time sitting, have a higher risk of osteoporosis than do those who are more active. There are certain exercise recommendations for the osteoporotic patients. Any weight-bearing exercises or activities that promote balance and good posture are beneficial for the bones. Walking, running, jogging, stair climbing, skipping rope, jumping, dancing, impact-producing sports, and weightlifting seems particularly helpful. Exercise will benefit your bones no matter when you start. This is very important because at the age of say 50 years, women are reluctant to start the exercise, feeling that throughout their life, they have not done any of the exercises. So now they are feeling that it will not be beneficial anymore, but it is not true. Any age you can start the exercises and you will have the benefit. But definitely if the people will start exercising earlier in life, in younger age, the benefits will be much better. Combination of strength training exercises, weight-bearing exercises, and balance training can reduce the chance of injury by improving the quality of bone health and reduce the risks of falling. See, the osteoporosis itself is the main pathology, but it is not causing harm to your body or not producing the symptoms as at a primary stage. But if the osteoporosis is the cause, the fracture is the result, which is producing a lot of problem in your daily life. So strength training and weight bearing exercises, these combination of these two are needed to improve the bone health, and the balance training is very much needed to prevent falling. Next very common symptom of menopause is musculoskeletal pain. It is important to restore estrogen levels to combat joint pain. Musculoskeletal pain, arthralgia, and arthritis increases with age and some appears to be associated with the onset of menopause. Arthralgia is experienced by more than half of the women around the time of menopause. The causes of joint pain in postmenopausal women can be difficult to determine as the period of menopause coincides with the rising incidence of chronic rheumatic conditions like osteoarthritis. So people will come with the knee pain or spine pain, but we have to determine the causative factor behind this pain. Because if it is just because of the age or age-related rheumatic conditions like degeneration or osteoarthritis, the treatment will be something else. Or if it is because of the hormonal deficiency, the treatment might be something else. So we have to be very clear with the causative factors for any joint pain. Changes in the body composition. This is a very important factor as far as the psychology of the people are depending. So there are two types of body types. We know that the obesity types are two types. Number one is pear type, number two is apple type. The average weight gain during menopause is 5 pounds, increases central fat distribution. Weight gain associated with metabolic syndrome, hot flashes, sleep deprivation, sedentary lifestyles, etc. And decrease in muscle mass. Resistance training are most beneficial. Although menopause may not be directly associated with weight gain, it may be related to changes in body composition and fat distribution. Several studies have shown that perimenopause is associated with increased fat in the abdomen as well as decreased lean body mass. This suggests that menopause plays a role in women's transition from a pear-shaped body to an apple-shaped body. That is, pear-shaped body means wide hips and thighs, more weight below the waist level, and apple-shaped body means wide waist and belly with more weight distribution above the waist level. Next is balance impairment. Changes in female hormones are known to affect the inner ears also, which are critical to the sense of balance. Women with frequent vasomotor symptoms seems to run a greater risk of unsteadiness and rotatory vertigo than do women without symptoms. This association may not be explained by means of a cross-sectional study, but there might exist a causal connection between vasomotor symptoms and balance distribution. CVD or cardiovascular diseases, a decline in the natural hormone estrogen may be a factor in increase in heart diseases in postmenopausal women. Estrogen is believed to have a positive effect on the inner layer of the arterial wall, helping to keep the blood vessels flexible. That means that they can relax and accommodate more blood flow. Despite of benefit of estrogen, the AHA recommends against using postmenopausal hormonal therapy just to reduce the risk of coronary heart diseases or stroke. So there are certain recommendations by AHA regarding the dietary pattern and regarding the exercises. So dietary pattern recommendations are fruits and vegetables more whole grains, low fat dairy products, poultry, fish and nuts, and limiting the red meats, sugary foods and beverages. 150 minutes of physical activities per week and 300 minutes or more weekly for a significant weight loss program, depending on the individual. That can be associated with walking, cycling, swimming, dancing, etc. So 150 minutes of physical activity per week and 300 minutes of weight losing exercises. Now focusing on our part, that is the exercises as a whole. So it has to be a combination of exercises, combination of weight-bearing exercises, that is low-impact weight-bearing activities such as walking, Tai Chi, and yoga. High-impact weight-bearing exercises like jogging and vibration platforms, etc. Along with the weight-bearing exercises, we have to include the resistance and strength training program, that is weightlifting, resistance cycling, swimming, etc. So these exercises has to be done 4 hours per week, 60 minutes per day. So at least 4 days a week, they are recommending the exercises. So let us describe this weight-bearing exercises. You can see this one: squatting, single-legged standing with support, sit to stand activities with the proper posture maintenance, step ups, forward lunge, etc. The resistance training, which is very important for upper body, lower body separately, and balance training, definitely under supervision. So these physical activities and exercises have been shown to have reduced the risk of osteoporosis, cardiovascular diseases, depression, and obesity. Resistance exercise have a stronger osteogenic effect, and for exercises to be effective, its mechanical load should exceed that of the activities of daily living. That means a person, suppose a lady of say 45 years of age, who is doing daily life activities, household activities throughout the day, and if you are asking her to do the resistance training with say 1 kg of load, that will not, not enough for her. So the load, the mechanical load of exercise should be more than the activities of daily living loads. A combination of exercise that includes both resistance training and weight-bearing exercises is the best choice to optimize strength and function. Resistance exercise will give the muscular loading, and weight-bearing exercises will provide mechanical loading on the bone, which enhance the bone strength as well as the resistance. We can include the aquatic therapy, though in India, the chances and the environments, controlled environments are not very, very commonly available. But then also aquatic therapy is one of the most beneficial for this group of ladies. It relieves the joint bearing, it relieves the weight bearing joints from bearing load while exercising. Suppose a person is having a primary osteoarthritis in the knee and having the other problems related to menopause. So while doing the aquatic therapy, the person will do the exercises underwater walking, underwater jogging, etc. But the knee is relieved from bearing a lot of load. Improves general body circulation and reduces swelling, provides a comfortable environment for strengthening exercise program, improves cardiorespiratory capacity and endurance, can help to improve balance. You can see the group of ladies doing the aquatic exercises and enjoying it. And at the end, I do want to send this message that the social support of the ladies of same age can be the most beneficial thing for this group of ladies. Suppose exercising together, laughing together, gossiping together, this can be a psychological lifter for these group of ladies. Now, these are some of the coping with heightened menopause emotions. Meditation can help, regular exercise can help. Reach out for social support of similar age group ladies, that can also help, and set goals for hobbies, skills, and life challenges. So these are the things which can make this transition easier for this group of ladies. Thank you so much.
Thank you, ma'am. Anybody have any questions? Am I audible?
Yes, you are audible.
Okay. Then nobody is asking anything. Anyway, thank you very much, ma'am, for sharing your valuable knowledge to us. I also thank you to our technical team, entire technical team, for this successful event. I will thank to all the participants for joining this webinar and for spending time. Thank you, everyone. Thank you very much, ma'am.
Thank you.